Time trying to prevent encounters with law enforcement from turning deadly. 10 Investigates has uncovered the state reversed course on part of its training for new officers, and Jenna Bourne has been investigating issues surrounding what law enforcement calls excited delirium. For more than a year now, she found they're now backing off on getting hands-on.
Records from FDLE show the state made those changes last year, and this new approach could save lives. But we found local law enforcement agencies are still teaching outdated info, and that could put people who are in crisis at risk.
It's just unexplained.
Willie Fudge Jr. still has questions about what led to his cousin's death 7 years ago. Paramedics took Mundre Francis to Largo Medical Center for emergency mental health treatment.
We need an officer here right now, please.
He's knocked several people to the ground and beat them. We have bloody employees.
Reports from Largo police reveal officers handcuffed Francis, restrained his ankles, shocked him with a taser, and pepper sprayed him. Hospital employees told police Francis went limp after staff injected him with an antipsychotic and a sedative. A state attorney's office report says the actions of the officers were lawful and they used ordinary caution and reasonable force. Largo police turned down our request for an interview. The medical examiner found blunt trauma, physical restraint, and asthma contributed to Francis's death, but they labeled his cause of death excited delirium syndrome. When's the first time you heard the phrase excited delirium?
When you just mentioned it.
6 years after Francis died, the state made changes to how it trains officers for cases like his. Excited delirium, or hyperactive delirium, has been characterized over the years as a sudden state that can involve agitation, confusion, paranoia, hyperactivity, hallucinations, high body temperature, sweating, and incoherent shouting.
Brian, calm down, we're just trying to help you.
Every major medical organization has now turned its back on excited delirium, but police are still being trained that it's real and they need to be ready for it. In November, 10 Investigates uncovered that Florida medical examiners identified excited delirium as the official cause of death or contributing factor for 78 people since 2010. At least 81% died after law enforcement used force, restraint, or both. Now 10 Investigates has learned the state made a big change to its basic recruit training on excited delirium last year. Florida's Criminal Justice Standards and Training Commission reversed course on its go-to instruction to taser and restrain those people and call paramedics. Instead, the updated training says to remove excess stimuli by turning off lights and sirens, and possible containment in a controlled and safe environment can ensure safety for everyone while the incident runs its course prior to EMS arrival. And this is a big one. The revised training no longer describes excited delirium as a life or death situation, or connects it to sudden in-custody death syndrome, something it's done for years. FDLE backed out of 2 scheduled on-camera interviews with us about these training changes, so we drove to Tallahassee to try to get answers. We asked for the FDLE commissioner.
He's unavailable, but if you have information you want to pass along, I can take your number and card and I can pass that along to him.
FDLE did answer my questions over email. They wrote, "The changes were made to the curriculum in 2023 at the recommendation of the subject matter experts, a mix of medical doctors, criminal justice officers, medical first responders, and instructors." Okay, so the state updated its training for recruits, but what about all the officers already working in our local law enforcement? We reviewed the training and policies on excited delirium for 10 of our Tampa Bay area agencies and found they largely have not made changes like the ones the state made last year. For the most part, local training is consistent with the state's outdated recommendations, encouraging officers to taser and restrain people so they can get medical treatment, and warning that they might suddenly die. The Hardee County Sheriff's Office was still using the training from the state's old Florida Basic Recruit Training Program textbook until we started asking questions. They've now switched to the updated version. The Hillsborough County Sheriff's Office's Crisis Intervention Training Lesson Plan says to have one deputy's agency-issued taser at the ready. This lesson plan is more than a decade old, dated 2013.
Hands-on with the subject is usually unavoidable.
HCSO shared this video recorded in 2020 that they used during annual in-service training.
At this stage, the subject may stop breathing, so be prepared for this. There's usually a high death rate associated with excited delirium at the end.
Sarasota police use crisis intervention team training taught by an outside company, Kenneth Training and Consulting. Their training PowerPoint says this will be a physical restraint call and the risk for death is imminent.
Why is there a picture of the Hulk from Marvel on your slide?
The owner of that training company, Charles Kenneth, justified it by saying officers need to know they're dealing with someone who's losing control, but the situation can be de-escalated, like how Black Widow is able to calm the Hulk.
Hey, big guy. Sun's getting real low.
Sarasota police turned down our request to interview the chief.
I miss his laughter, I miss his presence.
For dozens and dozens of Florida families, it's too late for policy changes. Mundre Francis's family won't get him back, and 7 years later, they're not holding their breath for accountability.
Every last one of them that was there and had something to do with him being restrained like that, when he there to get help and y'all wind up hurting him.
Reporting in Largo, Jenna Bourne, 10 Investigates.